So, talking about the global burden of tobacco use, it kills up to half of its users, and more than 8 million people are killed annually by the use of tobacco. More than 7 million die because of direct tobacco use, and 1.2 million are exposed to secondary जिसको हम पैसिव स्मोकिंग बोलते हैं, राइट? Then 2.5 million people they die because of smokeless tobacco and non-smokeless tobacco. So, if I talk about the burden of tobacco use in India, it is the second largest consumer and the second largest producer. According to the Global Adult Tobacco Survey, India estimated the number of tobacco users is 26.7 crore with 19.9 crore users of smokeless tobacco, 10 crore smokers and 3.2 crore users of both smoking and smokeless tobacco. This is the graph showing the state-wise distribution of burden according to the Global Adult Tobacco Survey, and India here stands at 28.6%. These are the two of smokeless tobacco and smoking tobacco. Now, if I talk about the burden of tobacco amongst the students in India, the age accountable here is 13 to 15 years, out of which 8.4% use tobacco, and 9.4 boys and 7% girls are affected. 7.2% of the same population use the smoking tobacco, 12.5% consume the smokeless tobacco, and 12% are reported to be exposed to the passive smoking in their homes. So these are the forms of tobacco which are used, smoking and smokeless. You can see bidi, cigarette, hookah, cigar, chillum, and smokeless forms, as you know, they are gudka, kheni, mishri, creamy snuff, and mawa, and many other forms. So these are the new products, but they are banned in India, especially the electronic cigarettes, jewel pods, vaping pens, herbal tools, and nicotine patches. So to curb the menace of tobacco, these are the tobacco control efforts which the government has been making since years. CODPA Act was introduced in 2003, WHO FCTC in 2004. The most important program which we deal with is the National Tobacco Control Program, and there are many other programs which are running across the entire nation. Talking about the National Control Program, it runs with the 3-tier structure. There is a centralized National Tobacco Control cell which takes the data and controls the state tobacco cell. Then under the state tobacco control cell we have the district, and under the district we have the sub-district level, that is block and the village levels. The data is collected and quarterly reporting is being set through this system. CODPA Act 2003, the cigarettes and the other tobacco products, Prohibition of Advertisement, Regulation of Trade and Commerce, Production, Supply and Distribution 2003 Act. Now this was enacted by Parliament in the 54th year of Republic of India in the year 2003 and has undergone several amendments to strengthen its provisions and address emerging challenges related to tobacco control. The primary objective of CODPA is to reduce the consumption of tobacco products and protect the health of the citizens of India. To regulate the production, sale, distribution, advertising and consumption of tobacco products, the Act encompasses various provisions that aim to curb the tobacco epidemic in India, which has significant public health implications due to various health risks associated with tobacco use, including various types of cancers, respiratory diseases and cardiovascular problems. Section 4 prohibits smoking in public places. As you know that smoking is prohibited in public places, so protection from exposure to second-hand smoke is there. Indian law categorically provides that no person shall smoke in any public place. Initially rules framed in 2004, later comprehensive set of new rules on May 30, 2008 notified for effective realization of objectives of smoke-free environments as stipulated under the Indian law and the World WHO SCGC. These rules are implemented since October 2, 2008. So these are the public places where smoking is actually prohibited. If we talk about the airport lounge, airports can have a facility of providing a separate smoking lounge, and even in corporate offices we have separate smoking lounge now. But these are the like cinema halls, banquet halls, canteen, coffee house, amusement centers, guest houses, stadium, railway station, bus stands. Everywhere smoking is prohibited, and it falls under section 4. These are the statutory signage for smoke-free public places. All the smoke-free, the public places should have smoke-free signages, and all the buildings on the entrance, floor, staircase, and other areas should reflect these signages. Now, implementing smoke-free rules at hotel, restaurant, and airport. As I told you, there are separate smoking areas in the hotels. Section 5 permits the prohibition of tobacco advertising, promoting sponsorships, that is taps. It prohibits all forms of direct and indirect advertisement of tobacco products. These are prohibited in all forms of audio, visual, and print media. It prohibits all forms of promotion of use or consumption of tobacco products. Prohibits promotion of trademark or brand name of tobacco product in exchange for sponsorship, gift, prize, and scholarship. So this is how the section 5 is violated. There are some tapris or small shops where the brands are being advertised, like the cigarette brands of Gold Flake and other products also, you can see. This is section 6, that is prohibition of sale of tobacco products to minors and certain places. So it prevents supply of tobacco to the minors, that is children. Prohibition on sale of tobacco products to minors, clear and prominent indicator at the point of sale against the sale to minors, no sale of tobacco products in any manner by which they are directly or easily accessible to minors, and no sale of tobacco through vending machines. And you can see this picture. Government has set a rule that every tobacco product should have 60 into 30 centimeter of advertisement promoting that tobacco kills an individual. Section 6B promotes the warning boards at school and educational institution. According to this rule, every school and institution should have a board outside which says that sale of cigarettes and other tobacco products in an area within a radius of 100 yards from this point is strictly prohibited, and the offence is punishable with a fine which may extend to ₹200. Though there are many many inputs given to the government that the fine which is being imposed for this offence is too less, and now government is thinking over to enhance this punishable price, this money to lakhs. Section 7, 8, 9 and 10, that is tobacco product packages. All tobacco product packages produced, manufactured, imported for sale in India to carry health warnings as specified by rules. As I told you, they should have 30 centimeter into 60 centimeter pictorial graphic reflecting that tobacco kills an individual. Again, this is the same slide. And these are the images of violation of the PHW rule, that is pictorial health warning rules. They are not following the rules, and there are many products in the market as well. So these are the penalties. You can see again 200 rupees fine, 1000 rupees fine for the producers, manufacturers, and the maximum fine is only up to rupees 5000. So now amendments regarding the fine money is also being discussed in the parliament itself. Now these are the prohibition of electronic cigarettes, as I discussed earlier. All these electronic so-called cigarettes are banned in India, but still they are available in the market. Talking on the Food Safety and Standard Act 2006, tobacco and nicotine shall not be used as an ingredient in any food product. To fulfill the real import of the provision, state notifications under FSSA to prohibited use of any kind of additives, scents or flavoring in all tobacco products. Regulation 3.1.1 of the Food Safety and Standards Regulation 2011 regulates the use of anti-caking agents like carbonates of calcium and magnesium products in food products. Juvenile Justice Act 2015. Now this is very important for the care and protection of children. This act was introduced in 2015 and it is on the ban on the sale of exposure of tobacco to the minors. 77 article says whoever gives or causes to be given to any child any intoxicating liquor or any narcotic drug or tobacco products or psychotropic substance except on the order of a duly qualified medical practitioner shall be punishable with rigorous imprisonment for a term which may extend to 7 years and shall also be liable to a fine which may extend up to 1 lakh rupees. So tobacco sachet and pouches, they also damage our environment. So this is Environment Protection Act which was introduced in 1986 regarding plastic waste management. This is the Motor Vehicles Act 1988 that says under section 95 which empowers state governments to make rules for conduct of passengers in private vehicles. That means nobody can smoke in private vehicles as well as public vehicles like trains, aeroplanes and buses, etc. Remember that tobacco is a villain. You all know we being the dentists are the first line of defense for the tobacco cessation across our nation, and Maulana Azad Institute of Dental Sciences is conducting a very good program on tobacco cessation pan-India basis. This is my photo. I represented the institution on the capacity building of dental professionals in tobacco cessation in 2024, and this certificate was awarded by the Ministry of Health to our institution, where in 2026 we are going to complete 2 years of our tobacco cessation center and training as well. So I would like to highlight one point here, that our tobacco cessation center is also working actively. We are screening certain patients and those who are at the risk of causing oral cancer or any pre-malignant lesion or condition are duly counseled, duly recalled. We keep a strict follow-up, and to your knowledge, we have more than 15 successful counseled patients in our college. So thank you so much for spending your time and hearing